Discover the lab test that could prevent a heart attack or stroke. My name is Dr. Stephanie Saucier. I'm a non-invasive cardiologist and a board-certified lipid specialist. I created this heart health guide for you to simplify medical jargon into what we all can understand. It's free to access. I will be putting the link below. And so let's follow along and let's jump in. Did you know that 1 in 5 people inherit a genetic abnormality in their cholesterol called elevated Lp(a) or lipoprotein A? It's inherited, so you can thank your mom, dad, grandparents, someone behind you. It is an independent risk factor for heart disease and stroke, and so it's really important that you are aware of this important risk factor. There's a few easy steps that you can take to help modify your risk just in case you do have a high Lp(a). The first step is the easiest step. Just get it tested. Learn if you have an elevated Lp(a) or not by asking your doctor to order you a test. If you have high Lp(a), follow along because we're going to talk about ways that you can lower your risk for developing heart attacks and strokes in the future. First and foremost, this is genetically determined. So if you have high Lp(a), it's important to have your family tested. So your parents, brothers and sisters, and children should all have their Lp(a) tested. Next, you really want to manage your other cardiovascular risk factors. Cardiac disease has a lot of risk factors that you can help control, including getting exercise, eating healthy, maintaining a healthy weight, managing your blood pressure, making sure your cholesterol is well controlled, managing your diabetes if you have diabetes, and not smoking, just to name a few. But take control of some of those risk factors. After that, we really want to control your LDL if you have high Lp(a). Our goal is that you have an LDL less than 70. That may need you to have medications such as statins or other therapies to help get that LDL to goal. And talk about this with your doctor, but it is important that we manage and lower your LDL as low as possible. And there's great news that there are clinical trials ongoing for 3 different medications that are designed to treat high Lp(a). These aren't on the market just yet, but they are in phase 3 clinical trials. So stay tuned as we learn more about these interesting drugs to help treat patients with Lp(a). Your heart health is in your hands. So download our heart health guide and follow along on this page for more tips, tricks, and information about how you can help protect your heart from heart disease.